The endocrine system. Say it with me. You can find the objectives in the module. What does the endocrine system do? The main function is the production of hormones to maintain homeostasis or a constant internal environment. Hormones are the ways that one part of the body talks to the other parts. They communicate through the bloodstream to regulate bodily function. You can measure levels throughout blood or urine testing. What is the primary function? Produce hormones. There are 13 primary glands, and they are presented here. The pituitary is located in the brain below the hypothalamus. It's like the master gland that regulates other hormonal balances. The hormones secreted by the pituitary regulates other glands as shown in this diagram. Different lobes of the pituitary do different things. The anterior lobe secretes hormones that affect the reproductive, integumentary systems, and the thyroid. The posterior lobe secretes hormones that affect the kidneys and the reproductive systems. How many major glands are there? Lucky 13. The pineal gland is small and located in the central part of the brain. It secretes hormones that affect the circadian cycle. The thyroid gland is located near the larynx and regulates the body's metabolism and calcium levels. There are 4 parathyroid glands that are super tiny. They are on the back or posterior surface of the thyroid gland, and they regulate calcium. The thymus is located in the chest or thoracic cavity and secretes a hormone that functions in the immune system. It's less after puberty. The pancreas is located behind or posterior to the stomach. It's part of the GI and the endocrine system. The islets of the pancreas are involved in the endocrine functions. The hormones produced there help to regulate glucose metabolism. The adrenal glands sit at the top of the kidneys. The cortex is the outer part and the medulla is in the middle. Medulla is middle. Keep making those word associations. The function of the adrenal gland is to control electrolyte levels, regulate metabolism, and plays a role in the sympathetic nervous system. The cortex releases androgens, or the sex hormones, corticosteroids and cortisol, both steroids, and aldosterone that regulates sodium and water. The medulla releases epinephrine, norepinephrine, both of which interact with the sympathetic nervous system. The gonads are the glands that produce the sex cells, sperm and eggs. The ovaries are the gonads in the female and the testicles in the male. The hormones released there are responsible for the development of sex characteristics during puberty and maintenance until menopause and menopause. Here are the stages of development of the secondary sex characteristics. Types of hormones secreted by the gonads are estrogen, progesterone, and testosterone. Hormones can also be secreted by fat cells like leptin and ghrelin. Neurohormones are produced by the brain and delivered via the circulatory system. What's the primary function of the parathyroid? Regulates calcium. Here are some medical specialties that focus on the endocrine system. Which doctor focuses on pathology of the endocrine glands? Endocrinologist, of course. Important word parts. Looking at the last slide then, what does acromegaly mean? Acro is extremities and megaly is enlarged, so enlarged extremities caused by a rare hormonal disorder. Here are some disorders of the pituitary gland. Acromegaly we just talked about. Gigantism means exactly what it sounds like. Hyper and hypopituitarism is either over or under production of hormones secreted by the pituitary. Pituitary adenoma is a benign tumor of the pituitary. Prolactinoma is a benign tumor that is producing excessive prolactin, affecting sexual function in both men and women. Galactorrhea is production of breast milk, not due to childbirth, usually caused by hyperprolactinemia. Dysfunction in production of antidiuretic hormone can be diabetes insipidus or syndrome of inappropriate antidiuretic hormone, or SIADH. Disorders of the pineal gland can be a pinealoma, which is a tumor of the pineal gland that affects melatonin production and affects sleep patterns. Dysfunction of the thyroid gland can be due to over or underproduction of thyroid stimulating hormone, or dysfunction due to inflammation called thyroiditis. Too much thyroid is hyperthyroidism. Toxic levels is thyrotoxicosis and results in thyroid toxic crisis. Goiter is thyromegaly, or enlargement of the thyroid. Graves' disease is considered an autoimmune disorder, and exophthalmos is where your eyes are protruding excessively from the socket due to hyperthyroidism. Hyperparathyroidism is overproduction of PTH. Hypo is what? Underproduction. The same for calcium concentrations. Hypercalcemia is too much calcium, and hypocalcemia is not enough. Myasthenia gravis is associated with an enlarged thymus. Dysfunction of the pancreas includes a tumor that secretes extra insulin called an insulinoma, or inflammation, which is called pancreatitis. Abnormal glucose levels can be excessive, not enough, or caused by abnormal insulin production. What is too much glucose called? Hyperglycemia. Diabetes you will all come across in your careers. There are two types, 1 and 2. Type 1 is due to abnormal production of insulin, and type 2 is abnormal utilization. The goal in treatment is to consistently maintain glucose levels as close to normal range as possible. Type 1 diabetes is an autoimmune disorder causing the destruction of the islet cells. It's often triggered by a viral infection. Treatment is diet, exercise, and insulin therapy. Type 2 diabetes is ineffective use of normal levels of insulin. People with metabolic syndrome, as well as those that are pre-diabetic, have a much higher incidence of developing type 2 diabetes. Treatment is diet and exercise, and the first line of treatment is oral medications. Insulin is added if the diabetes cannot be controlled by oral medications alone. Other types of diabetes are latent autoimmune diabetes and gestational diabetes in pregnancy. Diabetic emergencies occur when glucose levels are excessive, hyperglycemia, or too low, hypoglycemia. Too high, and the patient can fall into a diabetic coma or diabetic ketoacidosis. Too low, and the patient can go into insulin or diabetic shock. This is a great diagram that compares and contrasts the clinical picture of hyper and hypoglycemic states. Complications of diabetes can be damage to the retina, heart disease, kidney disease, nerve damage, and poor healing. Diseases of the adrenal gland are Addison's disease, which is low production of cortisol or aldosterone, or Cushing's disease, which is excessive production of cortisol. You can also have inflammation of the gland called, what else? Adrenalitis. Disorders of the reproductive glands are hyper and hypogonadism. You can tell me which one is excessive and which one is underproduction of the sex glands. Gynecomastia is excessive breast tissue in the male due to an increase in estrogen or decrease in testosterone. Thyroid issues can be diagnosed through blood testing or via radiology testing. Diabetes can be diagnosed via blood testing either for the initial diagnosis or to see if treatment is effective. Treatment of the pituitary gland issues can include administration of human growth hormone or surgical removal of the gland. For thyroid issues, medications or radiation are used in treatment or removal of the thyroid gland, either partially or entirely. Treatment for disorders of the parathyroid gland include removal of tumors or the gland itself. Same for the thymus. Essentially, removal of any of the glands is a treatment option, but then remember you have to replace those hormones that the particular gland was producing. For example, an adrenalectomy means you have to replace corticosteroids and epinephrine. Which is the test that tells you the average glucose level over the past 2 to 3 months? Hemoglobin A1C. I'm just going to pronounce these. Norepinephrine, oxytocin, pancreatitis, and parathyroidectomy. Which is the correct spelling? Exophthalmos. Just remember when you're talking about the eyes, OPH, TH. Just look for that root. And which one is the correct spelling? Hyperpituitaryism. You can refer to Table 14.1 for a list of common abbreviations. What is LADA? The last one. The other three don't even make any sense.